already hard to compete with these online platforms. Chris, you spoke to that, and maybe what I'd like to hear is just, and I know it's empirical, I know it's your personal, but I'd like to hear a little bit more about your personal experience of having, sounds like a successful group practice, and then these larger firms come and consolidate, and now it, more difficult to compete, right? And so you have to pivot. Like you're going to be okay. I get that, but you have to pivot and do something different. Well, what happens if they get so much control that there is no more pivoting? It's either join them or find a new career. Because that's what I'm
And
afraid the compact could turn into.
and I don't think just the compact will turn into that. Like, I don't want to dog the compact and make it seem as though that's the big focus. But I know one thing that I have brought up is, so what happens if, say, with these platforms, once they reach kind of a saturation, once there's so many providers working for them, and they have their contracts with with the insurance companies, right? And the insurance companies go, well, I have 2 million providers across the country. I don't need to contract with individual or group practices anymore. I have everything in-house. So I don't need to contract with, you know, Red Cedar Counseling or, this psychology group because we have it all in-house.
Well,
And
that's already happening. I know that for sure because I came across that in my work, not once, not twice, but multiple times. And not just in mental health, but predominantly in mental health.
yeah,
Mental health is kind of the last frontier. That's also why I'm so passionate about getting this out, is because guys, like when you talk about primary care, you know, 5 to 10 years ago, if enough primary care doctors had stood up and remained independent, it wouldn't just, you'd have some help. But for the most part, there's very few independent primary care physicians left. Like mental health is the last specialty that has not been fully rolled up.
and that was actually something that stood out to me when I don't know if it was in our first conversation offline or if it was when you were talking with the Texas board. It that stood out to me is that we are the last kind of bastion of independent healthcare because medical doctors, dentists, and many other and all the specialties are basically
Surgeons, all
rolled
the special.
under hospital groups or otherwise corporate practices of medicine.